Estimating the JVP is one of the most important and frequently used scales of physical examination. The JVP closely parallels pressure in the right atrium or central venous pressure, related primarily to volume in the venous system. The JVP is best assessed from palpations in the right internal jugular vein, which is directly in line with the superior vena cava and right atrium. Steps for measuring the jugular venous pressure. Make the patient comfortable. Turn the patient's head slightly away from the side you are inspecting. Identify the external jugular vein on the side. Then find the internal jugular venous pulsations. Focus on the right internal jugular vein. Look for pulsations in the suprasternal notch. Identify the highest point of pulsation. Extend a long rectangular object or card horizontally from this point and a centimeter ruler vertically from the sternal angle, making an exact right angle. Measure the vertical distance in centimeters above the sternal angle where the horizontal object crosses the ruler and add to this distance 5 centimeters. The sum is the jugular venous pressure. The carotid pulse provides valuable information. First, inspect the neck for carotid pulsations, often visible just medial to the sternocleidomastoid muscles. Then place your index and middle fingers or left thumb on the right carotid artery in the lower third of the neck and palpate for pulsations. Never palpate both carotid arteries at the same time. This may decrease blood flow to the brain and induce syncope. Careful inspection of the anterior chest may reveal the location of the apical impulse, the ventricular movements. Plan to further characterize these movements as you proceed to palpation. Keep in mind the anatomic locations as shown in the diagram. To palpate heaves and lifts, use your palm and/or hold your finger pad flat or obliquely against the chest. Heaves and lifts are sustained impulses that rhythmically lift your fingers. For thrills, press the padded area of your hand firmly on the chest. If you cannot identify the apical impulse with the patient supine, ask the patient to roll partly onto the left side into left lateral decubitus position. Palpate again using the palmar surfaces of several fingers. With the patient supine and the head elevated to 30 degrees, ask the patient to exhale and briefly stop breathing. Then, place the tips of your curved fingers in the left, third, fourth, and fifth intercostal spaces to palpate for the systolic impulse of the right ventricle. Auscultation of heart sounds and murmurs is a preeminent skill that leads directly to important clinical diagnoses. Throughout your examination, take your time at each of the 6 auscultatory areas. Concentrate on each of the events in the cardiac cycle.